Hi everyone, welcome to the Wellness Parenting Tips three-part webinar series brought to you by Boiron Canada. My name is Margaret Wallace-Duffy from Wallace for Wellness and Wow New Media, and I'm very honored to be your host for this series. We want to thank Boiron Canada for their commitment to educating and supporting new parents. Becoming a parent is a real gift, but it's not without its challenges, especially during quarantine. So we are ready to stock your parenting toolbox with tips and strategies to help your baby. So let's get started with our teething webinar. So Dr. Stephanie Yaremko is a naturopathic doctor who practices out of Calgary. She has been a naturopath for over 12 years, has a thriving family practice, and loves to support new parents. She also has a really interesting and diverse background and has done work with the Alberta Ballet Company, which is really, really interesting. But most importantly, she's also the mama to a beautiful baby, a 2-year-old. So she knows firsthand what it's like to struggle as a parent and want to do the best for your child. So we're really excited to welcome you. Welcome, Dr. Stephanie.
Hi, thank you for having me.
So how this is going to work, we're really excited because we want to go through a presentation. You're going to impart your knowledge. Feel free to ask any questions in the chat if you have them. If we have time at the end, we will answer them. But even if we don't have time, you can join our Facebook party on June the 3rd on Wednesday at 1 o'clock. You head on over to the Boiron Canada Facebook page and we will address your questions there where you can interact with not just Dr. Stephanie, but the next two practitioners that will be coming on over the next 3 weeks during this free webinar series. So Stephanie, I think it's time to dive in and start to support these new mummies when it comes to teething. And if anybody has questions, don't hesitate to ask. Just put up your hand and we will unmute you so we can get started. Okay, so let's get started.
Wonderful. And I just want to start by saying thank you, Margaret, for hosting this. It's a really wonderful opportunity for a lot of new moms to get really good information. And also a huge thank you to Boiron for bringing this to so many moms. It's pretty tough right now with all the isolation that everyone's under. And normally I give talks to the community, to mom and baby groups, and guess what? They're not happening right now. So this is a wonderful format that we can actually get to even more moms potentially so that they get this information, because almost every single mom has questions about teething and sleeping and gas, which is coming in the upcoming seminars. So thank you for hosting and thank you for bringing this to everyone.
Oh, my pleasure. So let's get started. So Fern, if you could just advance the slides for us here, please.
Sure.
Thank you. So let's start, Stephanie, by talking about, what is teething and what can mummies expect? Because there's such diversity, as you said during our discussion before this webinar, from child to child and from baby to baby within a family.
Yeah, and even tooth to tooth. So I get a lot of questions from moms about teething. And one of the things that moms and dads, parents in general, they're always concerned about whether their baby is doing it right. Is it on time? And so here is a good guideline of what is most common and kind of when most babies have the various teeth coming out. By no means does this mean that every child follows it. There are even some babies that are born with teeth already out. Doesn't happen that often, but it happens. They grow up to be wonderful adults. No problem with that. I even knew an adult who still had his baby teeth at the front here and never had adult teeth. And he had 4 kids of his own. So there are outliers on either end, and that does not mean that there's anything wrong with them per se. But usually you'll see the bottom 2 middle teeth are the first 2 to come out, generally between 6 to 10 months. Sometimes 4 to 5 months, you'll see that I do see that fairly often, but around 6 months is kind of the standard of when those teeth first come in, followed by the top 2 are generally next. I have seen some babies where the top ones come in first. So that happens too. There's no it has to be these ones, but usually you'll see the middle bottom 2 and then the top middle ones, and then it goes out to the sides and keeps going like that. And then finally, by the time they're between 2 and 3 years old, you start to get the second molars. So it takes a long time, between 6 months generally to about 2.5 years old, even up to 3 years old is their teething period. So you're in this for the long haul, moms.
It absolutely. And I can remember when my kids were little, we had to work for every single tooth that came into their head. And that's why I was so excited about this webinar, because we're going to be able to give some actual strategies, but knowledge is power. And if you don't understand, as you so eloquently said, Dr. Stephanie, is that you don't understand what to expect and when, it's difficult and it can cause us a lot of anxiety, which can contribute to the baby's anxiety. So let's go to the next slide and talk next about what else also can accompany this teething timeline that parents should be looking out for.
Yeah, so, and like you said, my daughter was actually a terrible teether. I had to use, like, every strategy we were talking today, I have used them all. And I had to use them all because she, like, very chill baby, except for when she was teething. So, you know, this is not just from experience in clinic, this is also at home experience at 3 a.m. A lot of babies will get diaper rash first. And this was also with my daughter. That was one of the first symptoms that I would know she was teething, because all of a sudden she would have this diaper rash, which she didn't typically have. And this timeline that's here shows about about a 1 week timeline. What can also happen though is that a tooth can start to come and then go back down, and then start to come and then go back down. And so this is kind of the faster version, the straightforward version when it finally does come through, but do know that sometimes some of those teeth are a little bit stubborn and they kind of go up and down for a while before it comes out. So with my daughter, with her first tooth, it was out in a day. Like, she went literally 1 day, diaper rash, fussing. All of this was like a 2-day thing, and there was a tooth the next morning. Some of her later teeth, this took like a month. So there's a big kind of span of what this timeline can look like, but often there will be diaper rash at the beginning. The baby is typically very fussy. Some babies aren't. Some babies, the only sign that they're teething is all of a sudden, ow, there's a tooth there when she bites my finger now. Awesome. If that's the case, you don't have to do anything. Your baby's fine. Like,
and
lucky
mothers like us will be jealous because we didn't have that experience.
No, but
exactly.
You know what? Wonderful. And the thing too is every tooth can be different. So I will say that typically you'll find certain children have more difficulty teething and other children have an easier time teething in general. But that doesn't mean to say that every tooth will be easy for a child that is easier, or every tooth will be difficult for a child that has a difficult time teething. So you just keep that in mind. It's very common for their cheeks to get a bit flushed, like a little bit red or pink, rosy cheeks. Their gums are often swollen around where the tooth is coming in. And you can usually feel that with your finger if you have your finger in their mouth. With them being quite fussy, they often aren't sleeping as well. So that's also a sign. And it can be very difficult for parents, because at the beginning it's like diaper rash and fussy baby. You're not necessarily expecting a tooth, and then all of a sudden you realize what's happening. So sometimes knowing that in the beginning allows you to start using the tools that we're going to talk about in a minute to help relieve some of the discomfort for your baby.
I think that's such an important point to make, Dr. Stephanie. Thank you for bringing that up, because certainly empowering parents with strategies, knowledge is power. So if you don't, like you said, if you aren't aware of what to look for, if this is your first time baby, or even if it's not, because every baby's different, if you have an understanding of what to possibly expect, you can, as you mentioned, can start to implement some of the tools we're about to speak about. One of the things that I didn't mention at the top of the webinar is that I'm actually not only a massage therapist, I'm also internationally certified with infants and special needs babies. I've done 2 research workshops at the Jackson Medical Center at the University of Miami, and I do a lot. I get about 80% to 90% referral from pediatricians. So I'm going to be contributing some knowledge as well as we go through. So I thought you should know certainly who I am and what I do. And I also meant to, and got sidetracked because of Boomer, introduce Leanne Sicard, who's on the call there. Wave for us, Leanne, so everybody can see you. So Leanne is a registered nurse and a classically trained homeopath who works with Boiron laboratories. I have to tell you firsthand, from a professional perspective, this woman is unbelievable. Her knowledge is exceptional. Her commitment and passion to supporting families is admirable. And she's going to be on here to answer any questions and beyond afterwards. So I just wanted to welcome Leanne, and she will be addressing us with some really exciting information later on that you're going to want to hear about. Okay, so let's continue on to the next slide, please, Fern. So let's talk about, and you addressed a lot of these, but just a quick overview of just a checklist of some of the signs and symptoms of teething.
Yeah, so I mean, we mentioned about the diaper rash can be at the beginning and the irritability or the fussiness, swollen gums, but also painful gums. Now that can be sometimes difficult to know because when babies start teething, they're not saying that my gums hurt. They're not verbal yet. They don't talk, but they tend to chew on a lot of things. They can have diarrhea. That's also common. Excessive drooling. The one thing I will say about that symptom is that babies tend to drool anyway. So a lot of times parents will see like their baby at around 3 months, 4 months, just drooling like crazy and chewing on everything. And they're convinced their baby is teething, and all that's happening is the baby is just exhibiting normal baby behavior. That's how they interact with the world. They put everything to their mouths and they drool. They haven't quite, developed the physiology of swallowing effectively, and the amount of saliva they make compared to the amount that they can swallow. It doesn't quite line up yet. So I always caution parents when they're using the drooling and the chewing as the only symptoms. While they are symptoms, they can also just be normal baby behavior. The nighttime wakefulness, again, this depends on babies. There are some babies that are wakeful all night when they're younger anyway. So for some moms, they're like, this is my child anyway. I know with my daughter, she was a great sleeper until she started teething. And I was kind of like that lucky mom that just from 2 months on, she just slept through the night. Then she started getting teeth, and that was no longer the case. So that's another sign that, particularly if you go from a good sleeper to a frequent nighttime waker, that could be a sign that they're teething as well.
So next slide, please, Fern. Okay, so let's talk about some tips. I mean, this is now for all you parents on the line, this is when we get to start to dive in and give you some strategies and effective tools to set you up for success. So let's get started.
Yeah, so all of these are things that I definitely did with my daughter and that I recommend people to do. The silicone teethers are really nice for the babies to chew on, and I recommend having at least 2 so that you can always have at least one in the freezer while the baby is chewing on the other one. The cold is really helpful on the gums, so cold helps with inflammation. And I do find that the silicone teethers don't stay very cold that long, so you're kind of constantly flipping them back and forth. One of the other things that I like to do when you've lost the silicone teethers because one has fallen out in the car seat and the other is somewhere and the dog has turned it into a chew toy or whatever, that happened in my house, is a clean washcloth and run it under cold water and then give that to the baby to chew on. And that's something that is great to do that if you haven't prepared anything in advance, like you have that within 10 seconds, you have something that can help soothe the gums. And I know, Margaret, you had some techniques with massage, so maybe you want to talk about that here.
Yes. So you're absolutely right. And thanks for being real and sharing what goes on, because parents are going to be able to relate to this. The dog ate it, the sibling, whatever, did whatever with it. And this is real. And I think that's what's so important about doing webinars like this, is to not only impart the education and empower you, but to also get really real about what goes on, and not just in COVID, but as a new parent. So one of the things I love to share with my patients, or when I speak on stages at the baby shows to help with teething babies, is to take that baby washcloth. And as Dr. Stephanie just said, you get lots of those given to you for gifts. So you've got many. I always like to have 3 or 4 in the freezer. And this is what I'm going to have you do with it. You're going to wet it and wring it out and put it around your fingers like so, and then put it in a Ziploc bag in the freezer. You want to take it out about 10 to 15 minutes before you're going to use it, because you want it to be semi-frozen, because you don't want any jagged edges that might cut the baby's gum line. Now you have this semi-frozen massage tool that you're going to put your fingers inside of this little frozen tool now. And here's what you're going to do. You're going to go inside the baby's mouth. Now, let me do a little bit of a background about why we're doing this and how, and then I'll show you how to do it. As Stephanie was talking about it in terms of teething, and some babies have teething symptoms, some don't. What's incredible, I was speaking to a good friend who's a dentist, and she was saying, Margaret, the pressure necessary to erupt a tooth through the gum line is equivalent, to give you some perspective, of that you need to crack a chestnut. That's a lot. So it's surprising that some babies wake up with a mouthful of teeth with no symptoms, whereas other babies really struggle. Here's the neat thing. Now, as a massage therapist, I've been at the birth of over 200 babies. I don't do that anymore to manage pain management when women are in labor. And often when women have back labor, we would do counter pressure on the sacrum to override, it's called the gate control theory of pain. We won't get into it, but what it essentially does is it overrides this painful sensation with a pleasurable one. We're going to apply that same principle inside the mouth with this frozen washcloth. So if this is the gum line, and as Dr. Stephanie had stated, often teeth are coming in at the bottom, but what's critical to note is that you need to do this firm massage with this frozen washcloth on both the lower mandible and the upper, because they're connected. And even though a tooth may be erupting here, the baby can be experiencing discomfort over the entire mouth. So you want to make sure you do top and bottom, a real holistic approach. So now what we're going to do is take this semi-frozen washcloth, you're going to go inside the baby's mouth. And if this is the gum line, we're going to firmly massage at the front, the top, and the back side of the gums, all the way along the lower jaw, and then all the way along the upper jaw. The massage is going to help with pain. The cold is going to help with the inflammation and the swelling that Dr. Stephanie talked about. And the massage with pressure, it needs to be firm. It's going to counteract, and it's like tricking the brain and turning off the pain signal so that the baby gets some relief. Now, here's the tips, moms and dads. Often a baby initially, when you go to put your hand in their mouth, they won't like it. You can win that battle. And once they feel the benefit, they will let you do it. Trust me. Similar to Stephanie's little one, I had my hand in my children's mouths from 7 o'clock to 11 o'clock at night when they were teething on a regular basis. And then you can use that semi-frozen washcloth to let them chew like a little puppy dog. Mm-hmm. So just another way to layer. And that's why I love collaborations like this, when we can layer ideas to give to parents so that you can have success when your babies are teething. So next, thanks, Stephanie, for letting me contribute. And next, talking about, I love this idea, baby purees. Oops, we can go back one more, Fern. We just jumped ahead too quickly. Thank you.
So often at the time when babies are starting to teeth, this is also the time that you're introducing foods. So one of the things that I like to do was to make baby purees and then put the puree in an ice cube tray and freeze it. And then it was very easy just to take out a cube of pureed squash or peas or whatever you're choosing to do, and put it in one of those mesh baby feeders, because then the baby can chew on that. And that also provides, it's like they're doing their own self-massage with the food. Plus they're also getting introduced to new foods as well, which is kind of nice.
That's a great tip. Love that tip. Okay, next slide. Fern, if you could do the next slide, please. Thank you. Oops. Oop. Quick fingers.
One of the, here we go.
There we go.
The confident mommy this is actually one of the main things. And this is true for teething, but it's also true for any kind of illness or ailment in your child. And it's really important that as a parent that you exude confidence and a sense of security for your baby, for your child. So one of the things, like when they're teething, like really comforting them, giving them lots of cuddles. At the time of teething, a lot of parents, if they're breastfeeding, they end up stopping just because it can be quite painful. And so I do encourage you to continue nursing if you're already doing that. But I will say that if the baby is starting to chew on your nipple, you need to take them off. 2 reasons. One, your nipple is not a chew toy. Number 1 reason, like that's just not helpful for you. But the other thing is that when they're chewing, they're not sucking, so they're not feeding. So at that point, they are literally just using your nipple as a chew toy. So at that point, you need to give them something to chew on that's not going to damage you. But really being confident in yourself that you can take care of your baby. And this is also where having a good support network of, whether it be friends, family, healthcare practitioners, all of that, to help support you when you're not feeling like, oh, I've got this, that they can be there to bolster you, because that safety and security that you exude to your child is really, really critical. So make sure that you're getting the support that you need so that you can feel safe and secure in yourself. Diaper rash.
Dr. Stephanie, if I can just interject there, because it's such an important point, and that's why I want to reiterate how important things like what we're doing here, thanks to Boiron, is because you can continue to reach out on Facebook pages and Instagram, or however, you know, or when you get an email from us, you can reach back. It is so important now more than ever, but always has been important to have that network where you can feel that you can get the support you need as a new parent. So I just wanted to really mention that. I know, Stephanie, that you're certainly open to answer questions, and people can follow you to get those answers, or if they're feeling like they're struggling, send you a direct message, as you can do to me as well. And I'm sure, Leanne, you feel the same way. We really do want to make you feel like you've got a team behind you, not just for education, but for support, because like you said, some days we just feel like we don't have it in control, and that's when you need to lean in from a mental health perspective and for the health and well-being of your baby.
Absolutely. And I mean, I know for myself, I felt really lucky as a new mom, having so much training and having seen thousands of babies and helped all, like, it wasn't a lack of knowledge from me, but sometimes there'd be times where you're like, I don't know if I'm doing this right. And you're like, well, if I feel that way, how does the average mom who
Right?
had 12 years of training and all of this, how are they feeling? Oh my goodness.
You know, it always amazes me. I treat pediatricians' babies, and they will ask me questions, and I chuckle and say, but you're a pediatrician. I think we have a common hat that we wear called motherhood. And when that happens, our heart's so invested, and there's so much going on in your own body and your baby. Cut yourself some grace and slack and lean in for support, which is why we're doing this. So I just really felt that was a really important point, especially now during COVID, but always. New motherhood can be a real challenge and a blessing, but we do need to have that support. So that's important.
Absolutely. Diaper rash, I always recommend having a good diaper rash cream on hand in case that happens, because the sooner you address that, the better it is for the rash, and making sure you're changing their diapers frequently. And particularly if they have a rash, then increasing the frequency that you're changing their diapers. And in general, like, I've never seen anything work better than a good zinc oxide cream. Like, when they have a bad rash, you probably need the zinc oxide cream. If they have a lighter rash, there's a bunch of different creams out there that you can use. The other thing too is that sometimes when they're teething, they'll see, parents will often say feverish, and it's not necessarily an outright fever, but they are definitely warmer than normal. So making sure that they're not overdressed, that they're not, sometimes see babies are like stuffed in under like 5 blankets, and they've got 3 hats on and 2 pairs of booties, and they're going to be overheating. That's not comfortable. So you want to make sure that they're wearing more lightweight, loose clothing if they're feeling warm, so that they don't overheat.
Excellent. Thank you. Next, Fern. Fern, could you? Thank you. So one of the things that has been in my medicine chest as a parent, but certainly in the medicine chests of thousands of my patients over the 28-year course of my career, is Camellia by Boiron Laboratories. And I know you feel equally as positive about this medicine as I do. So I'm really excited to hear your take on how this can help parents and how to administer it.
Yeah, so my first experience with Camellia was actually when I was working as a primary care physician down in Nicaragua in a hospital there. And we'd received a donation of Camellia, and the moms loved it for their teething babies. And so like hundreds of babies down there were given this, and it was incredible how well it worked. So that was my first experience. And, you know, it wasn't with just a couple of babies, it was with a lot. So I was like, wow, this stuff is amazing. And my cupboard was definitely stocked with my daughter. The things that I really like about this is water-based. So there's no preservatives or sugar or dye or artificial colors. Like if you look at the tubes, they're completely clear. They're also single dose units, which means as a parent, it's really easy. There are some other ones out there where you have to like mix and mash things up, which having a baby that was a difficult teether, adding extra steps for me would have been like not happening. So with these ones, it's very simple. Just like twist off the top and squirt it in their mouth. So I really liked this. The other thing with dosing is that most babies, you give them that one dose, wait about 15 minutes. Vast majority of babies, they calm down. They go from being quite fussy to like back to their normal selves within 15 minutes. Some babies need extra doses. So if after 15 minutes, they're still fussy, give a second dose, wait another 15 minutes. And then if they're still fussy, give a third dose. I think I might've seen one baby where that didn't work. And everyone else, it's always worked either the first dose or typically the second dose, and there's been a handful that needed that third dose. But it's really important to know that you want to give them kind of those doses a little bit closer together. So every 15 minutes if it's not working after the first dose. And a lot of parents don't realize that. So I think that's really important to know. And yeah, parents are really happy with Camellia. Like when I'm at the trade shows with Boiron, the number of parents that come up and just say, this has been a godsend, thank you so much, it's incredible. I was gonna say when my daughter was, I can't remember how old she was, maybe 8 months old or something, we got on a plane going to Europe. And when we got off that plane, she had 3 more teeth. That was like one of the longest plane rides of my life. You want to talk about not having, like, I didn't have a freezer there, but I was prepared. I brought lots of Camellia. I kept nursing her. I had like, and she also gave up her soother 2 days before this. So that was, you can manage, but like it was a lot of that confident mommy, cuddling, rocking, nursing when she wasn't chewing on me, Camellia, and just all, like, I didn't sleep. I will be honest, I did not sleep that flight. But nobody else on the plane knew what was going on. So,
and that says something, because that can be, you're often when you travel with a baby, that's one of the added stressors we have as new parents, isn't it? That, oh my gosh, are we going to be, the person that everybody's turning around and looking at, when in fact these poor babies, and then you add the added pressure of altitude change, and that makes a difference as well, which is why nursing is really helpful. Fern, if you could just go to the next slide while we continue this discussion, please, I'd appreciate it. Yeah. So that's amazing. It is amazing. So yeah, if you
4th tooth on her way on the flight back. So I was like, wow, this is, this is just wonderful. Some general tips. So like 3 to 6 unit doses per day. With Camellia, you're not dosing based on the weight of the baby or time. You're dosing based off their symptoms. And I will say that like fussiness and irritability is the main symptom that I would use with Camellia. The main ingredient in Camellia, by the way, is chamomile. So it's very soothing. Chamomile is also a natural anti-inflammatory. So it's helping with that inflammation. It's helping to soothe and calm the baby. And the maximum dose is up to 6 unit doses per day. But some babies, they might only need 1 or 2 doses at night, and that's all they need. So you don't have to give them 3 doses in a day if your baby doesn't need it, which is really, I think, important to know. And then others, like my daughter, are more difficult, and you're going through boxes of this stuff. But
right, but exactly. Yeah. And what I also love about it, all of what you're saying, but I also love the ease of it. It comes in sleeves that you can just throw in your purse or in your diaper bag. And like you said, on an airplane at the ready, you can get it out, and it's so easy to administer, which is so important. Then next slide, please, Fern. So as you can see, Camellia is one of the top selling medicines in the teething market in Canada, and for good reason. I mean, the efficacy, the feedback from parents, babies do love it. And, it's something that I can say through 28 years of practice in my own children and thousands of babies. parents will come back with their second baby and said, oh, I've already got the camellia ready. But what is also really important to both Steffi and I as registered healthcare professionals is that we understand that there's science to back things up. And I would like to welcome Leanne now to just talk about an actual observation study. I'm a science geek, so I love to hear when we're pairing science, because a lot of people don't always know that there's actual science to back some things up. So if you don't mind, Leanne, joining us. So once again, Leanne is a registered nurse and a clinically trained homeopath. So welcome, Leanne.
Thank you. Yes, I'd love to talk about an observational study that was conducted in France. So 190 pediatricians were participating in this study with 597 children aged between 3 months and 24 months that were observed for 7 days. And the results were that 77% of parents were satisfied with the efficacy of camellia. It is the #1 medicine that's recommended in France for teething. And so it's quite popular and works effectively. And then the other thing was, according to the study, 85% of parents, they decided that they would use the product again. So they were happy with it and decided that they wanted to use it again. So that's pretty good. That study is available on PubMed. So it's an observational study that was done. And goes to show you that what we're finding at baby shows and things like that, and the reports back from happy families, happy parents, saying that they will use it again and that they're happy with the effectiveness as well. And one of the other things I just wanted to say, I know we've been talking about the which I have here to show you guys, the actual packet itself,
Awesome.
with the camellia. And so these are great. They're, as was suggested, they're wonderful to pop in your baby bag or diaper bag, and they do keep the product stable. Okay, so one of the reasons why the company does decide to make them and put them in these packages are for ease and stability. Once they're opened, so you just have to tear it open. Okay, and you can still keep it in the sealed container or not open rather, but they come in these pre-measured unit doses, as was mentioned, just showing you visually what they look like. And so you just peel one of those off, and then that gets twisted off, and then it gets squeezed into the baby's mouth. So it's a liquid, it's a milliliter, and it's not a numbing agent, so it's not needed to rub around. The gum line doesn't contain any benzocaine, as we were saying that it's all natural. So just thought I'd show a visual of actually what it looks like, and so that families can see.
Oh, thank you, Leanne. And you know what? That is fantastic. I should have had that one in front of me. So that was fabulous to be able to see how easy and simple it is to administer. And I love the fact that you're sharing a study. Now that PubMed study, if any parents would like to get a link to that, by all means, you've registered on the Academy. We're more than happy. We'll do a follow-up email with the recording because I know there are parents that are going to be attending not live, but for those of you that are here, we can send a link. Leanne will get that to me and we will send that out to you so that you can take a look at that as well. And anything else, Dr. Stephanie, that you want to add? And we can certainly quickly open it up to any questions to anybody on the line. Anything, Stephanie?
I think that the biggest thing is really just sort of learn what you need to know, like the things that scare you as a mom. Figure out who you need to help support you with that, whether that be education on a topic, whether that be a healthcare practitioner that you can turn to for advice, whether that be a family member or a friend. That part I think is really, really critical. I mean, for teething, but also just in general, being a mom and helping to raise your kids is knowing who you can turn to for support so that you can be the best mom you can be and be the best for yourself too that you can be.
Indeed. You know what? You're so right. And that's why, our WOW New Media and Wallace for Wellness team was so honored to be able to host this webinar series on our One Life Academy, where this academy is about you. It's about helping to educate, empower, and inspire you. we couldn't do some of this type of education without the support of companies like Boiron. So make sure that you're signing up for the other 2 webinars. So next Wednesday at 1 o'clock, we also have a webinar in this series, and we're going to be talking all about gas and colic. I will admit that 80% of the referrals that I get from pediatricians or from parents is because their baby's struggling with gas. But we're also going to talk about digestive health, because that is so critical. It's not just if your child's struggling. Digestive health is critical to overall health, to their immunity, to their overall well-being. So you're not going to want to miss that. And that's with Mona, and I hope I can say her name properly. Kreshi, is that correct, Leanne? Am I saying it right? Yeah, I hope and I apologize in advance.
You are Mona Qureshi.
Good.
Yes.
Qureshi. And she is a pharmacist. So she's really excited to come and join us on the webinar series next Wednesday, May the 20th at 1 o'clock. So make sure you go back to wowmomandbaby.com and register for that. And then lastly, the last week of May on the 27th, yet another topic. And this is why we chose these topics, because they're the ones that the top of the list that parents struggle with: teething, gas and colic, and sleep. And of course, they're all linked together, which is why we put sleep as the last one, because often sleep patterns and sleep hygiene are interrupted because a baby is teething or has gas. So you're not going to want to miss that webinar with Debbie Fazio from Precious Moments Baby. She's a board certified sleep consultant. She's a mother of twins and an older child. They're much older now, but she knows what it's like to have babies and struggle. And so make sure that you sign up for those, and please share these links. Invite your friends to come along. And remember, even if you can't be here live, we will be sending this out in a recording. And then lastly, just a reminder, on June the 3rd, a Wednesday at 1 o'clock, keeping it consistent so we don't have to try to remember, we're going to have a Facebook party on the Boiron Canada page on Facebook. Don't hesitate to send us messages on their page, questions that you might have. We will come on there, all of the experts, to be there to answer your questions. But it doesn't just stop there. Boiron is committed to helping support parents through their journey of parenting as your babies start to age, and linking arms with other healthcare professionals to help give you the support that you need. That's so, so important. So if there's just one last call, if anybody has any questions that's on the call right now, and if not, or you're too shy to speak up now, don't hesitate to reach out to us afterwards. Okay, so on behalf of Boiron Canada, Wallace for Wellness, and our One Life Learning Academy, I want to thank Dr. Stephanie Yaremko and Leanne Sicard for joining us for this teething webinar. You know, there's nothing that fires me up more than to collaborate, to break down the silos and bring professionals together to put everyday people at the center and empower them with education so they can live well with their families. So thank you, Dr. Stephanie, for joining us. We really appreciate having you.
Thank you for having me. It's been a pleasure.
Awesome. And I hope everybody has a great rest of your day, and I hope everybody stays well and stays safe, and we will see you next Wednesday at 1 o'clock. Bye for now. Excellent. So Fern, if you could push stop on the recording, please.